Hi, welcome to Case of the Day, and we've made it to the eighth week, and this is the 29th case, a classic cocoon. So, this 30-year-old came with fever, ascites, nodes, was referred for an appropriate biopsy. It was between doing a supraclavicular or portal node versus the omentum and the peritoneum. And obviously, omentum and peritoneum is much simpler, so that is the biopsy I decided. The PET CT also shows significant uptake here. And so, did the biopsy this morning. And this is not about the biopsy and why CT guided, which, and why not ultrasound guided, which a lot of people come up with. You use what you have, and I do CT guided, and for many reasons, including the PCP NDT Act, I don't use ultrasound. But that's not the point. Sometimes it's just about the image. And even though I primarily don't do abdominal imaging, you still have to look at the abdomen during chest CTs and when I'm reading PET CT scans, and just look at this. This is a classic cocoon. The bowel loops are cocooned inside the peritoneal thickening, and then the fluid here, and you can see that on the coronal and the sagittal. But even that was not as striking as on the PET images. Look at the cocoon of the peritoneal thickening. And of course, there's a bit here that goes along the liver. You can actually see the cocoon on the MIP image, and on the sagittal images, the bare area is not involved, and obviously the retroperitoneum is spared, but you can see this here, and if you replace it with an image of a cocoon, then that's exactly what it looks like. It was so striking that I should put it up here today. And there are many causes of this appearance, but in our country, in young patients, I think by far the commonest cause is tuberculosis. And I was checking PubMed, and there's this article from AIMS with, Shrikant Murthy's team has done this. 4 cases, and it's worth looking at this. I didn't even know there's a term called encapsulating peritoneal sclerosis, though some others use the term sclerosing encapsulating peritonitis. And then the article talks about the differentials and what the various causes are. But again, of all of these causes, probably in practice, the commonest would be tuberculosis, malignancy, and post-op. So I did a quick search of my records with the word cocoon, and I found this 14-year-old. I had again done an omental, mesenteric, or peritoneal biopsy a few years ago, and this cocoon is even more striking. Look at the thickening of the peritoneum here. And the way it is, in fact, it goes up to the apex in the form of a typical cocoon here. There were a couple of post-operative recurrences of malignancies, but I don't think that's the point today. Sometimes it's just about the image when it's so striking that the pathophysiology is immediately obvious. That here we have a patient who has encapsulating peritonitis, and this is most likely tuberculosis. We've sent for everything, and I'll post on YouTube once the biopsy results are available in a couple of days or so. If there are surprises, well, then I will be proven sadly wrong, but otherwise this should be TB. That's the WhatsApp channel, and thank you so much for viewing this. Take care.